In the last two videos, I've introduced you to two of the three key digestive secretions in the GI tract that influence SIBO. Now, we're going to take a look at the third, bile. Bile is the primary secretion of the gallbladder, made in the liver, concentrated in the gallbladder, and released into the small intestine. Well, this brings us to the primary reason you are here, creating balance in the small intestine again. So let's recall that the stomach and upper small intestine are harsh environments. When we talked about hydrochloric acid and pepsin in the stomach, we learned that these two substances make it very difficult for bacteria to flourish. But as we transition to the small intestine, we no longer rely on acid, but now transition to pancreatic enzymes and bile. So since we've covered pancreatic enzymes in the last video, let's move on to bile. And the role of bile is twofold. One, it acts as an antimicrobial. So what that means is that it's going to influence the growth of bacteria, fungus, and parasites, and it's going to inhibit their overgrowth. Ideally, what we're looking for. That's its first role. The second role that it has is what's known as emulsification of fats. That's just simply a fancy way of saying that it breaks down fats into smaller molecules. The reason that that is important is because as those fats get broken down into smaller molecules, it creates more surface area on those fats. And now the enzyme from the pancreas, specifically lipase, can be more effective. And so when we think about the digestion of fats, mostly it is taking place in the small intestine and because of bile and the pancreatic enzymes. Once that whatever digestion of fat takes place at that point, that's it. You're not digesting fat any further than what happens with those two secretions. So if you don't have adequate quantities of those, we're going to see some problems with that, and we're going to feel the effects of it, which is why we need to make sure that they're optimal. So let's start off by asking the question, what causes lack of bile production? Well, here's a couple of things to consider on this. The first is just liver dysfunction. Remember, bile is made in the liver, so if the liver is not healthy and functioning optimally, then we're not going to see it be able to produce bile in sufficient quantities. Another reason that we can see lack of bile production is insufficient intake of certain nutrients. For example, taurine as an amino acid, methionine, choline. These are all going to be found in animal-based foods. So if your diet is extremely limited in animal-based foods, there's a good chance that you might not be making bile efficiently. Removal of the gallbladder. Many individuals have had their gallbladder removed, what's known as a cholecystectomy. But this inherently increases the risk of small intestinal bacterial overgrowth. And just in general, if you follow a low-fat diet, if you have reduced fat intake, then you're not getting adequate stimulation for your gallbladder to contract and secrete that bile into the small intestine. So these are all things that can result in lack of bile production, but they're all things that can be corrected. So what are the effects of insufficient bile production? Let's go to the next portion of this, and there's a couple here as well. So the first is that if you're not breaking down fats by secreting bile, well, you're going to have fat maldigestion. And fats are an extremely important macronutrient. They're an extremely important structural component to almost every structure throughout the body. You need fats. So fat maldigestion can become a problem without adequate bile. Next is you can start to see fat in your stool. If your stools float or you even see fat globules in the toilet, that's a big red flag. And you need to be thinking you're not digesting your fat as well as you should, and maybe the starting point to look for is bile. You can also have deficiencies in your fat-soluble vitamins. You'll know these as things like vitamin A, vitamin D, vitamin E, vitamin K. We're going to talk more about these when we get to phase 3 here in the SIBO solution. But just know for the moment that you can become deficient in these. And these are very common deficiencies if you have SIBO that are often left uncorrected and can set the stage for a relapse of SIBO. Well, remember, the whole reason you and I are having this conversation is so you don't have to continue to go through this. We can correct this issue and not have it return. And then the last issue you can see with as a result of having insufficient bile production is you can also see constipation. Constipation results because turns out bile is just a natural stimulant to your bowels to promote bowel motility. So without adequate bile production, you're not going to move your bowels as efficiently as you should. And that's another problem because, as we'll talk about in the next video where we get into motility, that motility and lack of can become a significant factor in the onset of SIBO as well. So here's the question, now that I've given you what the problem is, how they manifest, and what the scope of it is, how do we correct all this? We don't want to just have these problems continue to evolve on and on. Well, the first thing that we can do, and probably the most obvious here, is that if you're not secreting bile, we can replace the bile directly. That's just the easiest thing to do. And I would recommend using a product called Beta Plus to be able to accomplish that. Now, let me give you some direction on how to take Beta Plus. You're going to take one of these with each meal. So when you eat breakfast, lunch, dinner, you're going to take one of those Beta Plus tablets. And you want to take that before your meal or during your meal, but ideally you don't want to take this after your meal. And you want to complete this for at least 9 months because remember, 9 months is what we have to get past to make sure you don't become a statistic of relapse like so many individuals do. In fact, like almost half of individuals do. In addition, what else can you do? Well, you can support your digestion by making appropriate fat choices. And what I mean by that is not shying away from fat in your diet, but making sure your diet has consistent intake of fats, but also high quality fats. Saturated fats, monounsaturated fats mostly. And we also want to eliminate the overgrowth because as we eliminate these overgrowths, which fortunately you've already done here in phase 1, is that results in an increase in nutrient uptake. And as that nutrient uptake increases, that aids in bile production. And the decontamination, or if you want to say it better as the removal of the bacteria, also directly affects the liver. There is a link between small intestinal bacterial overgrowth and liver dysfunction. So when you clear up that overgrowth, that inherently is going to allow your liver to be more functional. That is going to translate as you're going to be better able to produce bile so that it can concentrate in the gallbladder and move on into the small intestine when it needs to. So now that we have covered bile, and that formally addresses all of our digestive secretions. So all of them have a different role, but they're all equally important in correcting SIBO and, more importantly, preventing recurrence. So from here, we're going to transition to an equally important topic, bowel motility. This will be the last topic we need to address so that you can have a complete approach to managing and preventing SIBO.